Super quick one. If you've been liking our content so far, show us some love by subscribing. It will only take 2 seconds of your time to click the subscribe button, and it's free. That way, we can continue to grow the pod and bring on people and conversations that you love. If you already have subscribed or followed, thank you. Okay, if you've ever been told that your period pain is just normal, I need you to really stay on for this episode because our guest today, Krystal, spent 20 years believing exactly that. She was fit, she was strong, she was a dancer, and she even powered through all of that. But somehow her body was telling her, no, this is not right. I also brought the doctor who finally caught what everyone else missed. Dr. Debbie, she's a consultant gynecologist from Hospital Picaso, focusing on fertility and minimally invasive surgeries. Dr. Debbie, Krystal, welcome to Head Over Heels.
Hi.
Hi.
It is truly a very important topic for the women out there because a lot of us really probably have experienced what you did, Krystal, which we will get to your story in just a bit. Why do you think our healers should continue listening to the end of this episode, and why it's so important to pay attention to this conversation and topic?
I think a lot of women that see me at my clinic has stories like hers. And I think a lot of women out there need to listen to her story and what they can do for themselves because what they go through is actually absolutely not normal.
Also, before we start, everything we talk about today is not meant to be medical advice and should not be a substitute for seeing your own doctor. So now let's get started. We're going to start from the beginning, okay, Krystal?
Okay.
I feel like you are representing everyone, every woman listening right now. So we know that you're very active since young.
Yeah.
But maybe walk us through, to the day you got your period and how it all started.
Well, just to give you a brief snapshot, I got my first period when I was 12 years old. And it happened on a Sunday when I was having lunch with my family.
Very specific.
Yes,
I love.
because I remember this day and I kept thinking what's going on with my body. So I went to the toilet having a lunch dim sum with my family, and then I was like surprised with why am I getting like blood spotting or like blood on my panty. So I ran out after that from the toilet and I went to my family and I said, Mom, I have blood. and then I think my father heard that first thing and my mom was just stunned, and my father was speaking in Cantonese saying like, oh, quickly go and like see what's it can't be. How is it so early? It's just, she's just 12. And so I didn't know what they were talking about. And so my mom followed me back into the toilet and she confirmed that it was a period.
Was it spotting or like fresh blood?
It's fresh blood. So she didn't have like a full-on pad at her hand the other time. So she handed me like a small mini pad.
Like a panty liner?
Yes. So I didn't know what it was and I just stuck it on my panty and then just went out together with my mom. And then that's when everything started. Like everything changed. And that's when I first discovered period.
Yeah. And, you got it at 12. I actually got it when I was 12 as well, which is it very young, Dr. Debbie?
Nope, that's absolutely normal. Actually, these days, girls get it even younger.
Really?
Because of nutrition, girls mature earlier.
Wow.
So the age is coming down. So 12 at that time, totally normal.
Yeah. I remember getting it at 12 when I was still in primary school. And my mom didn't teach me how to wear a pad.
Okay.
She gave me a wing pad.
Oh.
Do you know what I did with a pad? Funny story. I feel like I said this before in a very, very early season 1 of my podcast. You know how wing pads are?
Yeah.
So we have the wing, obviously. I was like, what is this for? My friend gave it to me. I stuck the wing on my thigh instead of underneath the underwear. Come on, I'm a 12-year-old kid. I really wouldn't know. No one taught me. No one ever talked to me about periods or wearing a pad.
Yeah.
Something as simple as that. So I stuck it onto the side of my thigh and then I walked out of the toilet. And then my friend was like, why are you walking funny? And I was like, no lah, you gave me the pad, I wear lah. Yeah, but whoa, no, you're walking weird. And I was like, I don't know, it's so uncomfortable. She's like, no, wing one's the best, my mother say, because it's so secure. I was like, how? You just stick it under. I was like, oh, I stuck it on my thigh.
Aww.
So I feel like that was my first time having period. And I mean, good to know that 12 years old is kind of...
Yeah, it's normal.
Yeah,
no
okay.
worries.
So then, Krystal, when did the problem start?
The problem started when I thought having heavy flow was normal.
How heavy are we talking?
like I have to change my period pad at least like 3 to 4 times during the day. Like, and it's heavy flow always during like the first to 3 day, the third day of my period. So I never really spoke about this, and I thought it's normal.
The heavy flow, did it come with like that pain?
Usually the pain is even worse if I eat the wrong food. I still remember when I was standard 5, I had pomelo because I was really hungry after my ballet training when I came home late at night. So I went to the fridge, I ate like a bunch of pomelo fruits. And then after that, the next day, I had this severe period pain, like excruciating. I felt like I could almost die, you know, like at that instant. Yeah. I thought it was normal, but I didn't dare to tell my mom that I was in pain.
What was the conversation like with your mom, with your family when you have heavy flow? I'm sure you have to go to the adult to ask questions, right?
Actually, it's something that we don't really talk about because in an Asian, like Chinese household, it's quite like a private thing.
Taboo, right?
Yeah, such a taboo.
And my mom never had an issue with her period. All I know that she got her period way later in her life, around like from 4 of very late. So to me, I thought I was not normal because I got my period at 12. I think that was something that Asian moms back then don't really talk about as well.
Yeah.
Remember what the day I got my period? My mom just, "Ayo, 咁快eh?" Then gave me a pat. That's the conversation I had. Like translation, wow, so early. That's it. Like there's no sit down, let's talk. What does it mean for you as a girl? You're becoming a young woman. Oh my God. I'm going to have that with my future child for sure.
Yeah.
But like, if you think back, quite clear, we didn't have the guidance and everything.
Like I didn't even have my friends to talk about because we were just trying to see, oh, you have your period already, you know. Like, I'm not sure you had that conversation. Like if you don't have period, it means that you're weird. Like,
oh, you're not yet?
Like,
wow, so late one.
like it's like a competition. I was like kind of out of that topic already. So because I was already someone with periods, so I just needed to know what I'm doing then on was like normal.
Yeah, I mean, speaking of normal, right? I do have this story from our healer. She said that, I'm turning 30 this year. And growing up, my mother always told me that having irregular periods, in brackets, around 6 times a year was normal because she experienced the same thing and still had us. So I never really thought much about it, even though people around me kept telling me to get it checked. So you see, sometimes in this case, she did ask her mother, even though 6 times a year, that means that's very little, right? We have 12 months in a year. So like, Dr. Debbie, I'm curious, like, is that even normal 6 times a year? Is that okay to just be okay with?
So it's like, this is really funny. So you're hearing ladies that mom didn't talk about it or very different from mom. And therefore, whatever symptoms you have is just being ignored. And then the other group that it's not normal, but because mom has it, aunt has it, nah, you're normal.
You're just like us, no problem.
Yeah, and some of the conditions that gynecological conditions like endometriosis or PMOS or irregular menses, they do run in the family. So when they approach their moms, like, nah, it's normal because I had it too. So we see that contrast there. So I would say that, if periods are irregular, they are painful, they're heavy, no, that's a red flag to get it checked. It does not always mean that something bad. Right? It doesn't always mean pathology, what we call that. It means something, a growth or a condition. But the key is to get it checked first. Then we know, oh, are you at the normal range, but just not as the 90% of the population, what we say, or there's really something going on that needs attention.
Okay, you say get it checked, right? So what exactly does getting checked mean? I can go to any clinic and
I would
just
say if it's a gynecological problem, see a gynae. Because, doctors, we are trained in different things.
Yeah.
So you might go to a doctor that's not trained to pick up a gynae condition and told you that, not absolutely normal and, it's not very in-depth kind of checking. So whenever we talk about checks, when you see a doctor, what we're going to do is we're going to ask some questions. We might perform some scans. There might be some blood tests. There might be some tests. And then we come to a conclusion. So nothing invasive, nothing scary. I know a lot of people are like kind of intimidated to see gynaes, but actually most of my patients will tell you that it's all right to get checked.
Then speaking of period pains, I feel like this is also a question that a lot of healers ask as well. I personally also get period pain, but it goes away after the first day of my period, the heaviest day flow. So does that mean I'm not normal? That because people say you're not supposed to feel pain, but then at the same time, period cramps and pain is also a normal part of periods. So when does it become abnormal?
All right, this is the confusing part. Well, in the past, we always think that when you have excruciating pain, when the pain is bad, okay, then that's when you get checked. Well, there's a condition that causes period cramps. That's what Krystal has as well. It's called endometriosis. So what happens is endometriosis has got stage 1 till stage 4. It affects different organs. Therefore, the symptoms that come out differ. So I've got patients that have got like 6, 7, 8 centimeters cyst, endometriotic cyst. They don't really feel much pain. And that's because that lesion is not very near nerves. And I've got patients that, well, the lesions are really small, like less than a centimeter, but their pain is excruciating. So what I'll say is, if you feel any symptoms that only pop up during period, whether it's pain, it's a weird pain, it's a back pain, it's a pain shooting down your leg, it's a pain at the shoulder tip or at the chest even. Any symptoms that come immediately before menses, during menses, and immediately after menses, get checked. It could be endometriosis, it may not be, it could be other diagnoses. But the key thing is it's difficult to just gauge by how severe the pain is and how long or how short the pain is. The important thing is to get checked. Then you know, oh, actually, is it endometriosis or is it, nah, you're right.
So from what I'm hearing, you're saying as long as you feel pain during periods, something is wrong?
It may be, it may not be. So
Which is why it's so confusing.
It's confusing. So it's also confusing for healthcare providers, especially if you're not specialized in this work. So which explains why some patients see multiple doctors and finally found the answer when other doctors say that it's not there. That's the problem with endometriosis. The symptoms vary, the severity vary. Very specialized type of scans can pick it up though. But the good news is these days you don't need surgery. We can assess it at clinic and you kind of know, do you have the condition?
Okay.
Yeah.
No, because if I were to tell you right now, like I have period cramps only during period, and it goes away after a day. And I've done my tests in the past and I'm fine. That means my period is part of my period cramp is now a normal cramp?
Well, it could be endometriosis. It could be pelvic congestion. There's a bunch of diagnoses to pelvic pain. And
but I've done my test and I don't have endo.
If you don't have it, then well and good.
But I still have the cramp. You get what I mean?
I hope you had a pelvic endometriosis scan because it can't be picked up from an ordinary ultrasound. There's this specialized scan called the deep pelvic endometriosis scan.
Right.
So that's the reason why a lot of patients have done different scans, seen multiple doctors, but the pain is still there and they're like, been told they don't have endometriosis, but for those of us who are trained to do that ultrasound, we're like, no, you've got that small nodule there, you've got that nodule there, you might not have a big cyst, but endometriosis does not always equate to a big cyst. It can be just nodules at different parts of different organs. Those are the ones that we want to pick up.
Got you. This episode is brought to you by Hospital Picaso. If there is something about your body you have been meaning to get checked, they are the ones to see. They have all kinds of services offered by their Women's Health Center. PMOS, endometriosis, painful periods that never quite add up, or even minimally invasive gynae surgery options that doesn't put your life on hold, and other things that we always worry about as women. Well, ladies, make sure you listen to your instincts and give your health the attention it deserves. For more information, go to hospitalpicaso.com. It's hospitalpicaso.com. PMOS used to be PCOS.
That's right.
That's the term most of us use prior to this year, right? So what exactly is PCOS? And with the name change, PMOS, from polycystic ovary syndrome to polyendocrine metabolic ovarian syndrome, what has changed?
A lot of us, especially gynaes, were just glad that the term finally changed.
Right.
Because the term PCOS gives a very misleading view of the condition. It says polycystic ovarian syndrome. So a lot of patients come to see me and say, oh, I've been diagnosed with PCOS before or PCOS before. Sometimes they don't give the term, say, oh, I was told of many cysts at the ovaries. And I'm like, were those removed? Oh, no. The doctor say that it's part of the ovary. So they get confused, like, do I have cyst? What is it? Another important thing to pick up from the term is the term syndrome. So when they change it to PMOS, we like it more because essentially it is a metabolic issue. That means it's a hormonal thing. So these ladies also have higher chance of getting diabetes, high cholesterol, overweight and obesity. And that's how it kind of screws up the hormone cycles. And as a manifestation, the periods become irregular or they don't come.
Which is why our friend here got 6 times a year.
Yeah.
Right.
Yeah. So on ultrasound, what we see is many follicles. Follicles are basically those eggs, right?
Yes.
But in the past, they're called polycystic. So to women, it's like, oh no, I have got cysts. Do I need to remove them?
Yeah, the word
it
cyst
surgery?
is so triggering.
Yeah, it's so triggering. It confuses. It makes women so worried. Probably a better description is polyfollicle.
Poly means a lot, no?
Oh, that's right.
Yeah.
Another key word to pick up from the term is syndrome. When I do an ultrasound and I see that the ovary has multiple follicles, like what people call as polycystic appearance or polyfollicular appearance, it doesn't mean that she has PMOS because that's a syndrome. When a syndrome, it must have a few criteria that meets the classification. So I can have a lady, I do the ultrasound, okay, looks like there's many follicles in your ovaries, but she doesn't have the other criteria, like her menses are perfectly regular, she doesn't have evidence that, oh, the male hormone balance is higher. That's why in ladies with PMOS, they can become more hairy, what we call as hirsutism, acne, a little bit like,
And weight gain
yeah,
too.
weight gain as well. It's difficult to lose weight. It's very easy to gain weight. And it's very frustrating for ladies, obviously.
Yeah.
When they have that, then yes, that's probably the syndrome, PMOS. But not all ladies, when we do an ultrasound and we see that features on the ovaries, that they have PMOS.
Actually, I do have a friend that she went to for a regular check, and all they saw is like multiple black dots, maybe clumped up in an area. Right away, oh, you have PCOS. And my friend panicked. I was like, huh? Wait, what? My period is regular? No, you have PCOS. Look, it's all black. Honestly, that is something very common out there.
Yes, that's
As a specialist, do you feel frustrated? And what do you think shouldn't happen?
Yeah, it's frustrated and it saddens me as well because it did come from, my fraternity in the sense that healthcare providers. So that's one thing that I do take time to explain to patients. Look, your ovaries, yes, look polycystic, polyfollicular, but let's look at your blood works, let's look at your symptoms, let's look at your cycles, let's look at your health. You don't fit the criteria. Your quality of life is great. Your health is all right. Let's not worry about the polyfollicular looking ovaries.
Then why is that follicles there?
Well, some people don't know, and I think about 30% of women that have that, 30% normal women have that sort of appearance. But it doesn't manifest clinically. It doesn't affect anything.
So it could just go away after.
Now they can look like that, but in PMOS, what happens is these follicles don't mature. They don't ovulate. That's why the periods are irregular. We have our menses after 2 weeks after we ovulate, when the eggs are released.
Yes.
So in PMOS, that doesn't happen. But in a lady that has regular cycles, I know she's definitely ovulating. But why exactly do the ovaries look like that? I think people don't really know, but we know that it doesn't have a clinical implication.
Okay. If you could just quickly, in layman term, explain what PMOS is and what's happening in there for someone who has PMOS. Can you break it down for us?
Yeah. So I always tell my patient, essentially PMOS is a metabolic issue. Now, what's metabolic? It's just how your body process sugar and metabolize whatever that you put in your body. So because there's an impairment there, something's not working right there. So the hormone cycles go a wee bit haywire. And therefore, the manifestations, the common ones is that periods become irregular because the hormone cycles are not regular. Number 2, the ovaries don't ovulate because our ovaries ovulate when a certain way of the hormones go and cycle and trigger the egg to be released. There's this thing called insulin insensitivity. So there's insulin in you, you're not diabetic, but essentially they're kind of like the same family, So that's why ladies with PMOS, there's also at higher risk of getting diabetes, getting obesity, they're higher risk at getting high cholesterol because our fats do convert hormones to estrogen. There's also slightly higher risk of getting cancers, like those that's hormone dependent, like breast cancer, endometrial, which is womb cancer, and things like that. Yeah.
Wow. So that name change is life-changing because
yes,
it's
totally.
no longer just about that cyst.
Oh, yes.
It is metabolic, it's hormonal,
Oh, yes.
which is what everyone's why they've been so confused all these times.
Exactly. So we are the happiest when the name changed, because it's really essentially not about how the ovaries appear and how many follicles there is. Essentially, it's a metabolic thing, and that should be the focus of the care.
Yeah. Oh my gosh. I never knew. I mean, I've heard of PCOS before the name changed so much in the past. Oh, I have PCOS, but I never really understood what it means. I just understood it very literally as polycystic mini cyst. That's it.
Yeah, it's never about that.
Wow. Okay. Krystal, back to you. So how did all of that heavy flow manifest for you as an adult, and what happened?
My body actually like went into a state when for a whole year my period didn't come. That's when my body started showing signs like, hey, how come my period is not regular anymore when I'm actually someone who monitors my menstruation very on a regular basis using the app. So with these kind of changes, I was constantly trying to search for answers. Doctors were all telling me oh, you're just stressed because I was working in a bank those days as well. So it's okay, that explains you are highly stressed. That could be it. So fast forward to last year itself, when I met my partner. I mean, we've been together for 2 years now. Even before that, I was telling him, I still want to find out what's wrong with my body, because I have been showing signs of very heavy bloating, every time before my period comes. I have very bad swollen, at my boobs area, everywhere, my pelvic side. I got hives out of nowhere when I was actively doing spinning classes, Pilates, things like that. So at that point, I was just trying to find out what was I not doing right. So all these are signs showing that my body is definitely not the same as it used to be. I thought I was healthy. This prompted me last year to continue to search for answers. In August, I decided to go to a female clinic. Honestly speaking, I think it was a mistake that I never grew up doing a gynae check at all.
Ever in your life?
Never.
Do you mind sharing at that point, how old were you?
Okay, it was, I'm 30, 3 this year, so it was 32.
For the first time in your life, you've done
So can you imagine? I've done
wow.
all kinds of tests, multiple blood tests, hormonal tests, all kinds of tests that all these wellness doctor or whoever has asked me to take.
Yeah.
I've been doing all these tests, for my heart or whatnot, but I just did not do a gynae check.
Okay. Never done pap smear and all that?
No, that last year in August was my first time.
Wow, okay.
And then because I was thinking, I think I'm normal. So why am I doing it? So because I was obviously prepping for marriage next time. So I needed to know that I'm healthy in a way. So that prompted me to go to a gynae finally. And then again, misdiagnosis the first time. I thought she diagnosed me as PCOS. She went on to say that you have this thing in your ovary, and then it has a lot of cyst. Yeah, what you just shared earlier with Dr. Debbie. She mentioned that I have a lot of cysts there. And then at the time I was like, are you sure? Because I have friends around me who has PCOS and I don't have that kind of symptoms maybe hair loss or hairy facial hair or overweight kind of thing, or all these kind of symptoms that you just mentioned with Dr. Debbie. So I never thought that I was a PCOS patient.
Yeah.
So she then went on to tell me that I need to take on certain supplements like myocytol for my condition. So for a while, I believed that I had PCOS from August last year. So, and then she said, come back 3 months later. I was like, okay, I'll just wait, continue this protocol that she just told me to do, and then come back in 3 months later. So, and then in October, so basically it's breast cancer awareness a month, right? So for me, I'm actually someone who's more particular and afraid of breast cancer because I have, my maternal side has history of breast cancer.
Yeah.
So that was more concerning for me rather than gynae check, all this.
Yeah.
So I went to a doctor to check my breast and get all these tests. And then I just sat there with the doctor and I tried to ask her about gynae problems when she's clearly a breast cancer doctor. So she was like, I can't really answer whether you have PCOS or not. Why not I refer you to this gynae? So on the same day, that doctor gave a call to that doctor, the gynae, and told her that I'm coming in that same day. So I waited and then just met my first other gynae.
Second one.
Who is not from the clinic that I went to. That was how all these things started, the search for more doctors. So that same day itself, I remember that doctor was checking, and then I remember she was doing that scan for me, and then I was like, okay, doctor, do I have PCOS? And she wasn't like confident to say that I have PCOS because she was a gynae. She was just asking me, do you have plans to get kids? And I was like, yes, of course. But that's not like why I came here.
Why
for.
are you asking
like,
that,
yeah,
right? Yeah.
She was like, okay, just get pregnant.
Huh?
Like, yeah. Then I was like, but yes, my partner is not even here, and like I'm here trying to find answers about what's inside, like whether do I have PCOS. And she's like, okay, you know what? Just quickly get pregnant if you can before you turn 35. And then she prescribed me with these hormonal pills. And I told her about like my partner not being around, like he's in the US, like our timeline is different than normal couples. So there's no way I'm getting pregnant now.
Anytime soon,
yes.
right? Yeah.
So with that, she gave me that, like she prescribed me with Vixen, this hormonal pill, and she told me to take it for at least 1 month.
And did you?
I obviously followed her protocol. Like I bought the pills, the hormonal pills, and I went back and I started taking it. Like she said it would change, like you might have like some like weight gain or things like that. So I was just like, okay, listening to her, but still not knowing whether I have PCOS or not.
I have a question. So she didn't even say you have PCOS or not. She
Yes.
just said get pregnant.
Yes.
And
She
prescribe.
said, like, do not do surgery, because I was asking her, doctor, do I need surgery or not for my condition? Can I do surgery? She said,
Yeah.
no. You need to get pregnant. Like, get pregnant. Like,
I'm
really?
sorry.
Like, that's really what she said to me, because she's a gynae and she's always delivering babies, obviously. So
She wants business.
So, but the point is, I was going there to try to find out whether I have PCOS. And she didn't give me any confirmation. She did the scans for me. And she was like, oh, I see like there's chocolate cyst here. I remember her saying chocolate cyst, but I don't know what that chocolate cyst is. Like, yeah. Like, to me, I know that I have multiple cysts in my body because the other doctors said
Also
I had
said-
PCOS.
yeah.
But then in terms of her like scans, like I was trying to figure out what's that. Like she couldn't tell me what it was, but she said, yeah, I think you have PCOS. And then she started prescribing me the hormonal pills. And I'm like really like saying, no. Like I know that this is not the answer, and I don't think I want to be taking medicine for like 1 month like that without knowing actually what's wrong with my body. So the next day when I went to this doctor, okay, I brought all my documents, like all my reports, all my blood tests, and even the medicine that I was being prescribed with.
Yeah.
So I went to him. I asked him, doctor, do I have PCOS? It's like, okay, you know what? He just kept saying, okay, let's just do that gynae check later, like the ultrasound later, and see what happens. And then he went through my scans and he said I had fibroid. And fibroid is not PCOS. Basically, that fibroid is a more concerning thing at that time.
Oh, it's like worse than PCOS.
Well, maybe
It's just different.
Yeah, it's
Okay,
different
okay,
thing.
okay.
So
It's a different
fibroid
thing.
was something that I had, which was about 3.5 cm sitting in like near my uterus. So
Okay.
that wasn't PCOS at all, but
Yeah.
that was something that was feeding on my hormones. So, okay, again, like
Something new.
Yeah, it's something new. And the doctor said, okay, what do you want now? Like, what do you want to do now? Because basically he said, this medicine, Vixen, you can continue taking, but it will not treat or cure like this fibroid.
Yeah.
For him, he picked up that, same thing. He said the chocolate cyst again. So chocolate cyst is something that I've been hearing from this doctor the second time, and then I still don't know what this chocolate cyst mean. Does it mean that it's PCOS? They cannot confirm that it's PCOS. They just said that, your blood, like during when you menstruate or whatnot, it just form like that blood clot.
I was told that before too, yes.
So I know that I have not only a fibroid now, but also a chocolate cyst. Yeah. So all I know is a chocolate cyst. Then I'm like, what's this chocolate cyst? Like, I can't get a proper diagnosis to what this chocolate cyst is in my
Yeah.
body, because I know that there's something, and then nobody can explain what's this chocolate cyst or what other, I know that the fibroid must be removed in a way because it will continue
Yes.
to grow.
Yeah.
So it would cause it would cause a danger to me as
Later
well.
on,
So
yeah.
in a way, I have to get that checked as well. if I do not want to get surgery or not, I have to get a second opinion. So
Fourth opinion.
yeah. Yes. I really lost track, to be honest.
Yeah.
So I was really lucky because Dr. Debbie's name came into the picture because I went to my mom and then she was like, if you know that you need surgery, why don't you find this doctor? And because the funny thing is this doctor's name was brought into the picture because of my sister, who's friends with her Dr. Debbie's sister from the same church.
Okay.
So like she has been hearing her name, like very reputable, like gynae, you know, in like that looks thoroughly into like female like health and stuff like that. So for me, okay, since I knew that I needed surgery eventually, but I just don't know when.
Yeah.
So it doesn't hurt to seek another doctor's opinion. So like the same week itself, I tried to schedule appointment with Dr. Debbie, but at the same time, I also scheduled another doctor's appointment. This one is my mom's gynae.
Okay.
Can you imagine? She's very old already. Like she's with a lot of experience. So this is someone that I needed to see to give my mom an assurance. To them, they think that they look at me, I'm well. Like why are you they did say like it's like a car that is healthy. The moment you send that car into the shop, it comes out with a lot of other problems. So you are like, it's like giving like
it's so
really,
Asian family thing to
it's
say.
true. Like I literally say the same thing back to my partner. You know, this is what my family has been saying, and then I was also quite sad in a way because I was trying to find answers for myself. But you know, people closest around me like are not really listening.
Yeah, it's frustrating.
So it was really like something that I was clearly not giving up for myself because I know that I'm going through all this and only I can tell whether my body is healthy or not. So fast forward to finally meeting Dr. Debbie. I brought all my, like, I think I brought a big bag. Like, I think I still remember. Like, I brought, like, I think Dr. Debbie's like, okay.
Yeah, what did your mom's gynae say?
Okay, so turns out, like, her appointment was way harder to get compared to Dr. Debbie. So I was like, you know what? Either way, I'm going to meet Dr. Debbie. I know that like Dr. Debbie would probably understand my problem more because my mom's gynae is definitely in her 70s.
Oh, what?
Yeah.
She's not retired.
She's not. She's like a consultant already.
Wow.
So can you imagine? She delivered all four of us and my mom is in her 60s now. So clearly her gynae is like OG. So I'm like, okay, mom, I'm definitely still going to see this doctor that delivered us, you know, like because in a way to give her assurance.
Yes.
So after meeting Dr. Debbie, I brought all my things and I showed her all my blood tests and all the scans, a bunch of things. And the first thing Dr. Debbie was like asking, okay, what can I do for you today? Imagine how many different doctors visit I have been to. I've said the same thing over and over again. So, but then with Dr. Debbie, I told her like, okay, you know what, doctor, like before you say or judge anything, you know, I have seen this doctor, like I went to this hospital, like I basically told her my history of like where
your dating history
to you
pretty
today,
much.
like you know, to my meeting with you today, like so I explained to her, okay, this is what like you know that doctor said I had, you know, just basically walking her through my medical history or the reports that I was being given previously. So and then she's like, okay, let's go like to do the scan now, like you know, like just hop onto the bed, and I was just lying down, and then she just started like walking me through like very calmly, and then like scanning me, and then I felt pain the other doctors didn't pick up, and she went to areas that you know she went on like going to areas and showing me scans that I didn't even understand previously, and like and it hurt. I was explaining to her, oh doctor, this like there's pain here. Oh, then she's like, yep, this is an endo. Like this filler is endo, you know.
This filler.
So like I don't know, doctor, do you remember how like what you said to me? Like because
No, I don't.
yeah. But for me, I remember it so much because I was like,
And the past three doctors didn't pick up that pain that you
no,
felt. Okay,
it was a
first
new
time.
pain. New pain. A new one, a new discovery basically. I was like, wait, this is something new.
Yeah.
So clearly these other doctors missed that part. And the fibroid, yes, it's so obvious is there because it's already 3.5, close to 4 cm.
How big is that actually? Like
It's like this.
wow.
sitting on my uterus. But so obviously it's bulging, like in
Yeah.
a way causing that bulging,
Yes.
like the bloated thing. So other than that, Dr. Debbie did pick up different parts that the other doctors didn't manage to. So I was like relieved in a way. Okay, so now like finally it's not in my head. Like you can finally tell me what is this chocolate cyst. Like, yeah. So she's like, I don't think you're PCOS, because I kept telling her that, the other doctors all told me like, I'm a PCOS patient and I need to take this medicine and blah, 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 blah. So she's tell me, well, I can tell you that I don't think you are PCOS at all now. You are endo. So that was the new word that I was learning like that same day when I met Dr. Debbie with on top of my fibroid thing.
Yeah.
So Dr. Debbie sat me through after that and then told me that, okay, so there's a few ways you can go about with your thing. It's ablation. It's like a microwave thing, like that she can burn.
Microwave?
Like a new
Microwave the chocolate cyst?
Not for the cyst, but the fibroid. So
Okay.
this is something that they can do that without surgical.
Right.
So because these are all new things that no
Yeah.
other doctors even proposed this
Correct.
technique to me.
Yeah.
Like they all just said that you either need to get pregnant, eat
Which
medicine.
is ridiculous, by the way.
Get pregnant, take this medicine, the hormonal one that would upset your body, obviously, with
Yeah.
a different kind of symptoms after that. And also do surgery, which is for the fibroid eventually. So Dr. Debbie proposed not only ablation, which is that microwave one,
Yeah.
the technique, and also told me that I had endo, I had a lot other, all these fillers sitting in my body. Like, I think as a doctor, she wasn't trying to push me to get surgery, but as a patient for me, the moment I heard her suggesting and proposing surgery, there's a way to solve what I'm going through and trying to find out all this while. I was relieved.
Yeah.
I really, in my heart, even before I made any decision or what, I was like, yes, this is what I want. Like
Like,
even
it felt
though,
right for the first
even
time.
without knowing what am I getting myself into, the moment when Dr. Debbie draw out like the treatment plan, like what I can do next, like there's also this surgery, a robotic one, all this and that. I was like, my heart, yes, doctor, I'm going to do it already. Whether it was just like, no doubt, like I was like, finally someone is validating all my confirming all the problems that I had and telling me that this is what I need to solve all these unanswered problems that I had been suffering all this while. So I have to thank Dr. Debbie for really being so patient with me, really giving me her time, for listening to me, not dismissing all my symptoms and what I was going through, and for proposing that golden standard, that surgery that I eventually said yes to. Yeah.
Oh my God, girl, that is insane story. That is, I didn't really expect that level of marathon after another, but I just got to give props to you for fighting for yourself, because you could have stopped at the first or the second one and listen to what everyone else said. But I think that's why I say women's instinct is so strong. We should always listen. But doctor, how did you feel hearing her story like this way? And what actually happened and what did you find eventually?
Krystal's story is quite a typical story sometimes for my
Really?
patients with endometriosis. Well, that's the reason why patients had to go from doctor to finally get a diagnosis and a treatment. And I'll explain why. So as she was talking, I was laughing a bit because they're quite typical stories, if you've got period pain, get pregnant.
Which is ridiculous, I'm sorry.
Yes, exactly, at this season, but I'll tell you why later. So let's start with, okay, first of all, is she PCOS, PMOS, fibroid? Chocolate cyst came in the picture, and then endometriosis and fibroid. What is it? Well, the even more frustrating thing is that, and confusing thing is that they like to come together.
Oh.
Right, fibroids are basically non-cancerous growth of the womb. I think a lot of people know what fibroids are. And endometriosis. So a lot of times I go in for a fibroid surgery, I find endometriosis. And a lot of times I go in for an endometriosis surgery, I find fibroids. About 80% they live together. So if I go in for fibroid, 80% of the time I find endo and vice versa.
Going in as in like really
Going for
opening.
surgery, yes.
Oh, wow.
Seeing it with my own eyes.
Wow.
And most of the time we can pick it up from ultrasound as well. Well, when it comes to PMOS, now this is quite fresh from the oven. There are more and more evidence to show that there is a correlation between PMOS and endometriosis. Like what I mentioned earlier, remember that just because your ovaries look as if they're polycystic, polyfollicular, it doesn't mean that you have the syndrome. Like for Krystal, maybe the earlier ultrasound shows that there are more follicles and her periods were a bit irregular at that time. And so she was just, I always feel PMOS is a bit overdiagnosed. I think it put a lot of women quite stressed out a bit and quite sad because every time they search out PMOS, they say, oh, am I infertile now? So I'm always very careful with labeling patients with PMOS, PCOS or whatnot. So latest evidence, I think, came out last week that when they do an ultrasound and pick up endometriosis, 35% of the time, they see that the ovaries do look like that. And there's more and more papers that's coming out that says perhaps about 10 to 15% of PMOS patients or endometriosis patients do have the other disease. So there are patients, and I see quite a number of them, they have both PMOS and endometriosis. Well, a lot more have endometriosis, not exactly the syndrome of PMOS, but the ovaries look like that. So that confusion can be there. And the whole thing, like now there's fibroid in the picture. So I was like, okay, now I know how potentially, confused she could have been. And the reason why she went from doctor, but at least they found the chocolate cyst. Now, basically, chocolate cyst is the endometriosis cyst. It's basically period blood that has accumulated. Now, why we nickname it chocolate cyst is because when we do a surgery, they literally look like a chocolate fondue.
Like a chocolate ball.
Now, it's like that. And then, when the cyst ruptures, it flows down like chocolate fondue because it's all period blood.
Yeah.
It's basically, endometriosis is basically the cells at the lining of the womb that comes out as period. They're very migrated elsewhere. And where can they go? They go anywhere. Favorite spots, the ovaries, the fallopian tubes, the womb, the bowels.
The period blood goes there instead of
the
going
cells that are already there. So when a lady with endometriosis have period of that month, the blood flows out, right?
Yes.
As per usual. At that spot, it has its own period party.
Huh?
That's how the chocolate cyst comes about. It comes out its own period blood there.
That's crazy.
Yeah, and that's why it is so frustrating because what the symptoms manifest depends where it is affected.
Or where the party is.
Yeah, exactly. Where the party is.
So where can the party be?
Anywhere. It's been reported everywhere, including the brain. And this is with a biopsy proof, okay? So lungs, a diaphragm, that's where right beneath the lungs. I've done a few surgeries that way. So when I do the surgery, remove the endo, I see the lungs at the other side. Very common is on the bowels, at the urine tube, near the nerves, the pelvic nerves, which explains why some people get back pain during period. Some people, they call it a period poo, during menses, they tend to get loose stools or, it's painful when she poops. Yeah. And a lot of people nickname that period poo. And some people get a lot of bloatedness and so-called, they're labeled as IBS. Asians, we don't really get IBS. It's a more problem. We don't really get IBS.
Half Angmo.
Maybe.
Yeah.
Yeah, so a lot of people get a very bad bloatedness. And that's because the endometriosis is sitting on the bowel.
So the cyst is sitting on the bowel. The
chocolate cyst, which when they're smaller, we call them nodules. So they're not as big as a cyst, but they're smaller nodules. And the problem is when the period party goes on there, it causes a lot of inflammation. And whenever there's inflammation, there's pain.
Yes.
So that's where pain comes about. So which is so frustrating. Some patients are like, all I get is pain at my shoulder tip every month. Or all I get is this loose stools every month. But when the doctor does the ultrasound, but there's no chocolate cyst. I don't see.
Nothing here.
Yeah, nothing at your ovaries. Now, this is when this is a myth among doctors.
Yeah.
So what was the scan she was mentioning that there was pain is what we call as an ultrasound, where I put it either through the vagina or through the anus, depending whether, it's a virgin or not. And from there, I specifically zoom in and look for all these endometriosis nodules. Now, it's called the deep pelvic endometriosis scan. There are many papers that's published. So this probably started around year 2021, I'm not quite sure. And that's when doctors start learning, hey, we can pick up endometriosis from ultrasound. We need to learn to look for the tiny nodules. We need to zoom it out. We need to understand this disease. Where is its favorite spots? A lot of times it's at the ovaries, and if we have it at the ovaries and there's a chocolate cyst, it's actually easier to diagnose. A lot of doctors can pick that up. Now, sometimes the nodules is at near the nerves. Sometimes the
like what
nodules,
nerves?
nerves at the pelvic nerves.
Oh.
That's why some people get shooting down the thigh. You had that, didn't you?
I
Krystal?
had that.
You
My
had that.
toes. Like,
You had that shooting pain down the leg.
During period.
Yes, only during period. And sometimes they get
Wow.
the period pool. Sometimes the bowels are attached. Sometimes it's near the ligaments behind the womb, what we call the uterosacral ligaments. That causes quite a fair bit of pain during sex as well. And the problem is all this chocolate cyst, like I mentioned, it causes a lot of inflammation. What happens is now the organs start to be stuck together. So I always describe it this way. You know, when we were kids, we have pencil case, right? We
Yes.
dump everything in, including our glue.
Yes.
And then one fine day, the glue accidentally spilled in there.
Yes.
And then all our pencils,
Become
eraser,
together.
everything gets stuck together.
Yes.
That is quite a typical look of how a stage 3, stage 4 endometriosis pelvis look like. So my job during surgery is to go in, zoom into every part of this, and start to release them.
How do you release them?
Oh, we kind of like cut them apart.
Whoa.
So it's actually very tedious and very delicate kind of work, you know, because I've got to now separate the bowel from the womb and take away the adhesions, the glue that's stuck together. But I have to preserve function. I can't just whack everything out, you see. So if the tubes are blocked as well, that's how endometriosis can sometimes cause fertility problems. I can't just whack out the tubes, you see. So I nicknamed them like renovation surgery. I've got to like separate them, fix it, try to make it back as original to before the disease hit as possible. So that is where the confusion came from. So the other doctors did pick up a chocolate cyst, but I guess they didn't put a name to it. I think I always tell myself as a doctor, I need to put a name and an explanation to what my patient's going through. Because like she saw 2 doctors that told her she's got chocolate cyst and even gave her the medication for it. But it wasn't spoken true to her. Look, your pain has a name. It's called endometriosis and your options are this.
You said chocolate cyst equals endo. But does all chocolate cysts equal endo?
Oh yes, chocolate cyst is a very specific description. It's a nickname given to the
Endo.
what we call endometrioma,
Right.
which is the endometriotic cyst.
Okay.
Yes.
I mean, if that's the case, then why did all the doctors who found the chocolate cyst didn't say it's endo? I thought not all chocolate cysts are endo, but you said it is.
No,
basically.
chocolate cyst is a nickname given to
Yeah,
endo.
so
why
why
they did, I don't know.
They never said that.
I don't know. But they did give the treatment for endo though.
But they just didn't explain or describe it to her.
Yeah, so that's something for me as a doctor to always be mindful of, that the way we explain things to our patients. I always tell my patients that I diagnose endo for first time. I want you to go back and read all about it.
And
I want you to be the kind of patient that asks AI, read all about it, because I realize the best control of quality of life and symptoms and disease for endometriosis subsequently are those that totally understand the disease. How would diet interfere? How would lifestyle interfere? How would medication interfere? How would that interfere with her quality of life and what to watch out for?
Yeah.
So
look, Krystal's story is really, I feel like, as much as it sounds crazy, I feel like a lot of people are going through that, not finding their answers, no matter how many times they've seen their doctor, they just something still don't feel right. Then my question is for you, Doc, what should a patient ask? Because sometimes we just, Doc, you tell me, but maybe we should ask certain baseline important questions. What are the questions that you wish your patient will ask when it comes to
yes,
this?
that's right. I think first of all, find the right doctor. I think this is something that a lot of people don't know as well. I mean, like, I have a gynae problem, I see a gynae or whatnot. Or some people have got period pain, I go see a general practitioner. I'm not saying that, other doctors are no good. But for us doctors, there are things that we specialize in. There are things that I'm good at. There's things that I'm not good at. Right? I think first of all, listen to your body. That's why for me, for endometriosis patients, the very important thing to do, like what Krystal mentioned, is that I listened. Why? Because endo goes everywhere. I need to listen to her symptoms, her story, to know where should I start hunting for the endometriosis and the disease. Secondly, do some research, do your homework. I think it's very important when you see a doctor to ask, okay, how come I have the symptoms? Based on your assessment, what could explain it? Well, sometimes it really is like, okay, let's say irregular menses, for example. This period of time, the last 6 months to a year, life has been extremely stressful. All the blood works don't show anything abnormal. It is the stress, the cortisol hormones that mess up with your cycles. Sometimes it's as simple as that. But before we say that, oh, it's just something like that, there are other tests we've got to make sure that it's not something more serious. It's not something that needs treatment.
Yeah.
Yeah, so I'll say be clear with your symptoms. Search for the doctor. I think these days doctors, we have no qualms with patients seeking for second, third, fourth, fifth opinion. I'm her fifth opinion, right? Clarify, get checked. I think the most important thing is get checked.
Yeah.
And roughly know what your condition is and look for the correct doctor. Like the kind of endometriosis ultrasound I do for Krystal, unfortunately, there are not many of us who are trained to do that. We are a training center, and we are training more and more doctors to do that. I think for a start, we always tell doctors, when patients come to you with period pain, they don't just give them MC and painkiller and dismiss them. Look deeper. If you can't look deeper, at least know who to refer to.
Yeah.
I think with endometriosis, it's very specific, so that is the thing. I think with a lot of other disease, it's not as tricky as this, right?
Yeah.
For those of you listening out there, don't think that, oh no, see doctor also know is because don't know which doctor to see. I think with endometriosis, it's tricky because it's confusing, because the symptoms differ according to where it's affected, and therefore the ultrasound and the findings as well.
But I suppose really listen to your body and find out where the pain and discomfort is coming
Yes.
from, because you might think it's nothing, but that could just be
Exactly.
the key to unlock your problem.
Yes. Have a diary. It's called a symptom diary. Note down like, day one of, or 3 days before menses, I have this pain. First day, it has this pain. Because even pain that comes before period, during period, and after period, the diagnosis differs.
Yeah. Actually, these days, there's so many different apps. Look, I'm
Exactly.
literally wearing a Whoop and an Apple Watch. So I do track my stuff every single day. Like, how do I feel? And during my period, are there any symptoms, spotting and pain? This episode is brought to you by Hospital Picaso. If you are someone who always says, it's okay, I'll do that checkup next time, and next time never comes, well, this is for you. Hospital Picaso has a women's health diagnostic package running till the end of the year, 31st of December, 2026. So there is a basic gynae screening starting from 438 ringgit only, and if you're over 40 years old, a combined gynae and breast package with a 3D mammogram is only 1,088 ringgit. If you've also been experiencing painful periods, they have a package for that too, with a blood test that helps rule out anything serious. Consultation is already included, don't you worry, and all you have to do is show up. Ladies, please don't wait on this one. If your body feels off, it might be trying to tell you something. So listen to it and get it checked. Click on the link and the description down below for the full package breakdown. Dr. Debbie, so what surgery did Krystal do, and what did you decide for her, and what did you find when you were inside?
Right, so Krystal had a keyhole surgery, and when it comes to endometriosis, the surgery, if ever you need surgery, disclaimer, not everyone needs a surgery. As much as possible, I always hope I diagnose patients who don't need surgery, because it just means it's very early stage, surgery is not needed, medication helps. And that's the whole aim. But unfortunately, in Malaysia and many parts of the world, really, if you read up, published data show that diagnosis is always delayed between 7 to 10 to 12 years, because there are not many people who are trained to pick up this ultrasound. Previously, gold standard of diagnosis is a keyhole surgery. Who wants a surgery just to be diagnosed, right? But these days, we can pick it up earlier. A lot of patients, by the time they come to us, they're at least a stage 3 to stage 4, which means it's more extensive progress of disease, and we need surgery, number one, to help with the symptoms. Because remember the whole glue in pencil case thing?
Yes.
Medications will not release that.
Right.
And so surgery is the only way to release that. And in some patients, they really do need a surgery to get rid of all those things. And plus the fibroid and whatever else that comes as a group of friends, I'll call them. They always like to come together. So she had a keyhole surgery. In endometriosis, the surgery must always be a keyhole and not an open surgery. Very good for patients, quick recovery.
Yep.
But the reason why is because this endonodules, they're very deep down in the pelvis. They're always all the way down to the vagina and to the bowels. So if I were to do an open surgery and just peeping from the top with just my naked eye, I wouldn't be able to clear the disease down there. Now with keyhole surgery, either with laparoscopy, meaning just putting in a camera and instruments to remove that, or better still these days, robotic, they're essentially both keyhole surgeries. I can zoom 10 times in and really hunt for these nodules. Now, when we talk about keyhole surgery, there's laparoscopy, which is just like straight instruments going in, and then there's robotic. In endometriosis, I always err towards robotic if it's a more complex case.
What does robotic mean?
Well, a good question, because a lot of patients ask me, Doctor, robotic means a robot take over.
Yeah,
I
that's
say
why
no.
I thought a robot come like, hey, hello.
Yeah. So what happens is that the arms, of course, the instruments go inside the patient, but
Right.
I'm sitting at console controlling the robot. Well, now why do I not just use my hands and
Yeah.
as if like using a chopstick to remove the disease? Is because I'll be limited with the angling in a conventional keyhole. In robotics, because now we can attach it to a machine that has more degree of turning and
Yes.
control than our own hands, I get back very precise type of control.
How do you decide when you need robotic, when you not?
Well, when it's a more complex case, I'll find that robotics makes a whole lot of difference. If not, I go back to conventional laparoscopy. Well, in endometriosis, especially in more complex cases, it's very important because the principle is to remove as much disease as possible, all if possible, but to preserve the organ. So let's say the bowel and the womb is stuck together. Now I've got to release the glue that's in between and remove the disease. So I've got to be very accurate with what I'm cutting because I need to preserve her bowel or her urine tube function as much as possible, or the fallopian tubes, because I don't want to damage the tube and then she can't get pregnant. So that's what she had. So at the same time, I also remove her fibroids, endometriosis. I think you had multi-organ involvement, right? Yeah.
5 affected.
So different places, quite typical with endometriosis.
So what were the organs affected?
I think you had ovary.
2 ovaries, 2 sides were affected, and then the uterus was the fibroid one,
Yeah.
and then I had bowel lesion, my bowel there,
Yeah.
and also this one was the concerning one because Dr. Debbie had to get my consent before surgery. She said it shows like my fallopian tube one side might be tangled up. So if when she goes in surgery, she might need to cut it, you know. But obviously I will have the other fallopian tube if I want to have a kid next time. So that was something that I had to prep myself, not knowing exactly what would the outcome be
So you
during the
gave her a
surgery.
yes.
Yes, of course. Like, you know, I wanted to get rid of it. So, but then thankfully, when I came out from surgery, Dr. Debbie said that further was just like, you know, something just hanging there like that. Like
Not
it
tangled
wasn't that severe yet. So she managed to just remove it like lightly without
wow.
affecting my fallopian tube. So
Yeah, so that's when robotics make a difference. So basically in endometriosis, the tubes like to be all clumped up together because they're all stuck together in that whole pencil case situation, right?
With the blood, the clots.
Yes, with the adhesions and the tiny endometriosis nodules. So as much as possible, I want to release all of that and to repair the tube. Well, sometimes they're very, very damaged in later stages where the tube can't be salvaged and then no choice, I have to remove the tube. But thankfully for hers, I could repair it and fix it and salvage her tube.
yes.
Oh my gosh, I'm so happy for you. So how do you feel after surgery?
Wow. Like,
Wow.
I mean, immediately after the surgery, obviously it was so heavily bloated here, but I felt so much lighter.
Wow.
Like everything was cleared from my body. Like clearly I knew that there was something not right inside, sitting like underneath my, around my pelvic area all this while, but I just couldn't like wrap my head around like what was the real cause of everything. So I think the surgery really relieved and gave me like a new fresh perspective to like, okay, this is like my restart button. Previously, I thought like I had all these unexplained symptoms and it's kind of like in my own head only. Like I couldn't even like find out what was the root cause of everything. But after the surgery, it's like life-changing.
Yeah, I can only imagine. Speaking of surgery then, Dr. Debbie, is there really such thing called gold standard?
Well, these days, yes.
Okay.
Like what I mentioned, endometriosis surgery should always be a keyhole surgery done by a trained endometriosis surgeon.
That is the key. Gold.
Yes. And the reason why is because, like what I mentioned, endometriosis goes everywhere.
Yeah.
Sometimes I see in the appendix, I've got to remove the appendix. Sometimes I see it on the bowel, where urine tube, the bladder, wherever. It has to be cleared. If not, we're talking about recurrence. That is when, you know, a lot of women tell me, you know, doctor, I've always been told endometriosis don't do surgery because you end up with 2, 3, 4, 5, 6 surgeries. I say that is a golden way of doing it. Number one, it has got to be keyhole surgery. Like what I mentioned, when it's more complex surgeries, I need better control. The more precise I am, the better job I can do. And that's when robotics come in the picture. Number two, they need long-term medication to not let the endometriosis grow back, because essentially it's a period problem. So if you do surgery, you don't go on long-term medication to suppress it and control it, like having diabetes and high blood pressure. There's unfortunately no cure as of now, but with treatment, control can be very well. So when I talk about control very well, what we're talking about? We're talking about recurrence, so that the patient does not need another second, third, fourth, fifth surgery. Number two, I think what's very important is the quality of life. I think women should be pain-free. Even when we're having our menses, we should still be able to go out, go to work, go hang out, do what we like. And I totally cannot stand the idea of, oh, you're a woman, you've got period pain, bear with it. A lot of my patients are told that way. A woman, you must be able to bear pain because one day you have to go through childbirth. I think that's just totally degrading, and it's just not right. So I always love it when women get back their quality of life and not limited by menses. And of course fertility for younger ladies. I think that's something very important to preserve as well.
Yeah, for sure. So if I were to simplify this, it's just so complex, right? I just don't think I can actually even simplify. It's not curable then.
Unfortunately, at this point of time, there's still no cure for endometriosis. When we talk about cure, we're talking about, okay, you have an infection, you take antibiotics for a week, you're cured.
Done.
Right? It's still like diabetes and high blood pressure. There's no cure. You need long-term medication to control it. But with that, control can be excellent.
So you are under control with medication?
No, so this is what I've discussed with Dr. Debbie. So I'm under this contraceptive thing. It's like, I think the symptoms will be less severe, right?
Yeah, in the sense that when I talk about medication, there are different forms. One is, of course, the pills, like birth control pills. And then there are injectables, like the implant, or what we call the IUD, something like an IUD, but it's medicated.
Okay.
I like that because it just acts in the pelvis. Because like for someone like Krystal, her disease is just in the pelvis. I just need a medication in the pelvis. She doesn't have elsewhere.
So it's not in the
body.
uterus, it's in the pelvis.
It's in the uterus.
Oh,
but the medication does cover the pelvis.
Right.
So rather than popping pills, and then some women find that they've got side effects and things like that. So with the medicated IUD, it is what we call as locally acting. It only acts in the pelvis. It doesn't go to bloodstream. I don't have to worry about weight gain.
But the pills will go everywhere, right?
Yeah, because it goes to the bloodstream.
Yeah.
So as injectables. Of course, the newer medication these days, the side effect profile is a lot better. But if we're talking about something long term, I think a lot of my patients are a lot more comfortable with the locally acting ones.
So you kind of bespoke, personalize the medication and solution for everybody. There's no one size fits all. Some maybe birth control pills.
Yeah.
So there's no cure to endo, but there is way to manage it for life.
Oh yes, definitely.
And okay, what about PMOS?
Well, PMOS, like what I mentioned, is a syndrome.
Yeah. So is there a cure?
Also complex. No cure, unfortunately.
Okay.
So usually I'll look at what is being affected. A lot of women, it'll be weight and metabolic issues and diabetes, insulin resistance. So that usually need to be worked on. And then if she's at a stage where she's trying to get pregnant and fertility is affected, that's when we come in and help her to induce the ovulation.
Okay.
And also one thing very important, yes, I must mention this. In PMOS, when patients do not ovulate and they do not shed their period regularly, what happens to that lining that's supposed to come out as period, what we call the endometrium, can become thick. And over months and years, when it's thick, they can turn precancerous or cancerous. So whenever we talk about cancer of the womb, it's usually endometrial cancer, which is that lining. And whenever I see a PMOS patient, I always have to tell them, I need to teach you on cancer prevention.
Oh my God.
I need to teach you on cancer prevention because a lot of women don't realize that. So it's just like, oh, if I can just bear with my period not coming for a year, I'll just let it be.
I'm not having a baby anyway.
Yeah, I don't really care. Okay, I don't have to wear pads. That's better still. But that risk of endometrial, which is womb cancer,
oh my God,
and precancer is there. My youngest patient that has PMOS
Yeah.
and has terminal cancer was 30 years old.
Oh my God.
30.
Being a woman is so hard.
I know
So much
sometimes.
to deal with.
Yeah, so much to deal with.
Oh
And
my
people
gosh.
dismissing you. Yeah.
Yeah, like it's just pain, normal.
Yeah.
Everybody got period pain, and I suppose what I've learned is really it's not normal. It shouldn't be to the point of unbearable, lah. Right?
Yes, exactly.
Yeah, I don't think you should bear the unbearable pain. Back to surgery really quickly. We actually have some really good questions from our healers, right? She said that if surgery is delayed by 1 to 2 years for endo, are there any potential risk?
I would think that if for whatever reasons you need to delay surgery or it's recommended by your doctor, because there is this whole debate and discussion to, okay, if a patient does need surgery, the golden question is when as well, right?
For her, it was quite soon.
Because she had symptoms, she needed to deal with it. It's not time to get pregnant, so let's get it done and prevent recurrence. So that is her kind of like formula or direction for her. Well, if for whatever reasons the surgery needs to be delayed, I would say start on the medical therapy first. Because we know that with every cycle of the menses, the disease grows more. So I don't want from stage 1 becomes a stage 2, a stage 2 becomes a stage 3, a stage 3 becomes a stage 4. So if you got to delay your surgery for whatever reason, at least be on a medication first. That's what I usually tell my patients.
Because endo is not hormonal. Endo is...
endometriosis?
Yeah, endometriosis.
Oh yes, it does feed on our female hormones, estrogen,
Hormonal,
which is why patients need that progesterone treatment until their menopause or if they are pregnant. Well, that's
why
about
the
pregnancy.
solution
Yeah,
was
that's
to
why
get
in the past, especially like 20, 30 years back, gynaes ourselves, doctors ourselves, we don't know what is this whole period pain about. We just know that patients in a lot of pain. But in the past, people get pregnant a lot earlier. So they don't get as severe disease as these days. These days we see a lot more severe disease, a lot more patients needing surgery. In the past, no, like our grandma time, like they start getting pregnant like 20 years old, 21 years old, and they have kids every 2 years, right? So the endo don't really have chance to grow. They did have endo, but they didn't really, it got delayed. The disease got delayed a lot more because they kept getting pregnant. Now, what's so magical about pregnancy and endometriosis? Number one, during pregnancy, period doesn't come. So that buys a bit of time. Number two, the hormone progesterone, which is the treatment to endometriosis, is sky high. So a very typical story we hear is that, when I was younger, I had pain, and then after that, I started getting pregnant, started giving birth, the pain disappeared. So people always thought that pregnancy cures it. No, because in the 40s, when say they stop giving birth, it comes back with vengeance. That's when it's very heavy, very painful, and that's when in the past, gynaes will say, your only option is to remove your womb and remove your ovaries, remove everything. That's the only cure. But these days, we understand the disease better, so we know how to target it.
That's why the doctor told you to get pregnant.
Exactly. So
Which is also not a solution because it can come back.
it is, exactly. It's not a solution for sure. It does help temporarily, but these days I tell my patient, no, pregnancy is not the treatment to endometriosis.
Yeah, can you imagine? I have you because I don't want to get endo.
Oh, that's
why mommy
horrible,
give
right?
birth to you. Oh my
That
God.
was actually something that my partner and I, we were like trying to figure out, okay, should we actually get
For real.
like kids right now, plan for like kid right now, even though we are still working on other things?
Yeah.
It was really a big question, like a big topic, because
And because it came from a doctor.
because there were not only one doctor, there were some doctors that was constantly saying get pregnant. So
So that's the story to why. So a lot of things that the previous doctor told you, I was just sitting here like, okay, giggling away in my heart. It's like, because I know why where that came from.
Right. Honestly, I feel like I'm still learning about this both of these syndrome and disease, and it's so complex. We will not be able to cover all of it. It's already been slightly over an hour, but I do have some very important questions from our healers, and that I think we should get to. Are you guys ready?
Yes.
Okay. How does these affect reproductivity if I want to have a baby, especially when I'm in my 30s?
Right. Let's talk about PMOS first. Now, we know that PMOS, when the whole metabolic and hormonal disturbance happen, that lady doesn't ovulate. That means release the egg. And we know that the egg needs to be released for one to get pregnant. So, and I like to say sometimes very stubborn, not very stubborn PMOS. That means when I give medication to help with ovulation, they respond. So not too bad. We've got a lot of different types of medication to help with ovulation. So that's the key thing to help in PMOS. Some ladies in PMOS also have what we call as progesterone deficiency. That means the level of progesterone, which is the hormone that supports the pregnancy, is a bit low. So if you do have PMOS, you get pregnant, you might want to ask your doctor, do you need to supplement with progesterone
Or
in
like
the
add
early,
on.
in the early trimester, in the first trimester. I think with PMOS, pretty all right. Let's say you don't respond to the medication to stimulate the ovulation. Now, there's this thing called ovarian drilling. That means we just help your ovaries to respond better to treatment. So no biggie in that. Endometriosis can be a bit more tricky, which is, for me, key to protecting fertility. I always tell my patients, I want to protect your fertility whether you want kids or not. That is key. Because once damage is done, you can't reverse it. And how can endo affect it? Number one, the growths at the uterus and the fallopian tubes, they damage the organs. So sometimes the tubes get blocked.
Yeah.
And at the womb is the evil twin sister of endometriosis is called adenomyosis, right? That means all this chocolate cyst happens in the muscle layer of the womb, and the womb swells up. So it becomes very unfriendly for implantation. So a lot of IVF doctors send their adenomyosis for me to fix first before the implantation. So you can have a good quality embryos, but they are just not sticking.
Nowhere to stick on.
It's just so friendly to support a pregnancy. So the baby doesn't want to implant there because baby wants a beautiful and comfortable home.
Yes.
I always explain it that way to patients. When I do surgery, I'm doing a renovation for your baby to sit in. And also data has shown that higher miscarriage rates, preterm birth. So I always tell patients, please, if you have adeno, do something about it now. When it's too late, sometimes hysterectomy is the only answer. Then you have problems with implantation and things like that. Another one is with the ovary. Now back to the chocolate cyst. What this chocolate cyst does is it can actually kill off the good eggs. So in a lot of patients with endometriosis, whenever you take a blood test called anti-Müllerian hormone, which assess how many, eggs do we still have?
Yes, I've done that.
You've done that, right?
Yes.
For sure, if you had IVF. In endometriosis can be slightly lower, especially if you do have the chocolate cyst. And of course, surgery technique is very important because when we remove a cyst from surgery, it's like peeling an orange, from the skin. And that peeling itself peel off good eggs, you see. So these days, thankfully, with technology and with more advanced medical care, we know that there are ways to go about it. So when I do a surgery for a younger lady with fertility concerns, I don't peel their cyst, I laser it.
What's
Or
the
I use-
difference then?
Because laser, I kill off the bad endometriosis tissue. I don't damage the good eggs at the back. Or in larger ones, I use alcohol, what we call alcohol sclerotherapy. Just put in the alcohol, kill off the bad cells from the cyst, but I don't strip the cyst out.
So why don't people just do that then without killing the good eggs?
Oh, well, that's a technique. No, well, not everybody. I don't know why other doctors don't do it, but I always do it. But I think it's something newer in the last few years
Right.
because in the past, there's a lot of peeling cysts because people worry about recurrence. So if you do search out about laser and sclerotherapy, you read that some papers do say there's higher recurrence. But if you really zoom in, there are very many different types of laser. Some does have a higher risk of recurrence, some don't. And the one that we use, actually, data shows that it's similar recurrence rates with peeling off the cyst. Another one, alcohol sclerotherapy as well. That means put in alcohol, let the alcohol sit there and kill the endometriotic cells. There's also a technique to do that. In the past, people just put in alcohol and wash. Now, these days, we know we need to sit the alcohol in there for at least 15 minutes to let it do its job properly. And data shows that those are pretty decent recurrence rates as compared to peeling off the cysts.
You mentioned hysterectomy.
Yes.
We actually have someone writing in and said that she's had a hysterectomy because of HPV. And she also have PCOS and endo. By the way, for those of our listeners who don't know what hysterectomy means, do you mind just breaking that down?
Yes, hysterectomy just basically
Hysterectomy.
removing
Sorry,
the
I'm not saying it right.
removing the womb.
So
So
you
the
got
entire
no more
uterus
uterus.
is no more uterus.
Oh my God, my heart is breaking. So sad. So she removed her uterus. So her question is, I still have both my ovaries. Does that mean I can still have PCOS and endo?
Oh yes, totally. Now that is another myth. A lot of women think that, okay, so endometriosis is a period problem. So now that I do not have periods because my womb is being removed, why would my endo grow? Now, if you go back to the definition of endo, it is that cells that's outside of the womb.
True.
So as long as the ovaries are there, you're producing hormone, and what feeds endometriosis is a female hormone, which is estrogen, which is how progesterone works. Progesterone has an anti-estrogen effect. So as long as the ovaries are there, yes, you still need treatment for endometriosis. It still can grow.
If she has no uterus, Where does her eggs go every month?
Oh, it just ovulates and it's in the cavity.
Oh.
Yeah. So every month when we ovulate, it doesn't mean that the egg goes into the womb. It's the
right.
job of the fallopian tubes to go and catch it. So the end of a fallopian tube has this thing called fibra, like finger-like. It's actually another word for fingers. They go catch the eggs, and then the eggs will go through the tube. Yes, and that also gets damaged during in endometriosis. So that explains why.
Understand.
So that's okay. The eggs float in the peritoneal cavity, and then
Yeah, and then it just goes.
it just disintegrate whatnot.
Okay. I feel like this question just makes me feel a bit heartbroken because she said that, is it my fault for not taking care of my body better? What really causes PMOS? Can I avoid it?
Right. Unfortunately, for both PMOS and endometriosis, there's a very strong hereditary or genetic correlation. So I think a lot of women are very discouraged or because in PMOS, your weight goes up, there's overweight and obesity issue, and naturally everyone blame, you must be like not taking care of your diet, you're not taking care of your exercise. I mean, those play a very, very important role in the care of PMOS. But I always tell my patient also, it's very unfair.
Yeah.
Because you can eat the same diet as another person that has no PMOS, that person remains the weight and your weight just keeps going up. It's very funny. I've got a friend who's a pharmacist, by the way. And she's like, I take a deep breath and I go up 1 kilograms, It's like, that's how unfair it is. And I tell patients, I understand. But I think I also know that a lot of people will just look at someone with PMOS, see, you're lazy, that's why your weight goes up. You don't take care of your diet, that's why your weight goes up. So it's not always your fault. That is a metabolic issue. That is a health condition. But having said that, you also need to put in effort with the lifestyle, with the exercise, with the diet. And I always tell my patient, do not expect that your body transforms like your personal trainer. Why does exercise help when, maybe physically you still look not
The
that
same,
much difference? I say it's because your muscle mass to your fat ratio changes, and that helps with your metabolic cycles a lot better, your metabolic health a lot better. So I always tell patients with PMOS, I know it's unfair, don't get discouraged. I think a lot of women get judged that way. They just look at your body and either you get body shamed or like, oh, it must be, unfortunately, I think some doctors do that to patients as well. Just change your diet, go exercise, and your problem will solve. But unfortunately, in PMOS, it's not their fault.
Yeah.
There is a health issue underlying that.
Yeah.
And they need help with that.
So that means bloating during period is normal, but it becomes abnormal when it's too... See, I don't even know.
Yeah, I know it's absolutely confusing
it's
because...
such a gray area that we're still in.
I know. So...
Because I'm thinking about whatever you said and I'm like, during period, I feel like I gained 1 or 2 kilos from the bloat. And I even feel the bloat in my body. But as soon as my period finishes on my 3rd or 4th day, wow, I am lean AF. Wow, I can see my abs again. I'm like, so is that normal?
It's hard to say honestly. A lot of
I need to
patients
come to
ask
you.
me that, So I always say, get a good assessment. If you don't have, you're clear from endo, well and good.
Yeah.
If there's something there, then we know that's contributing. And usually with treatment, that bloatedness go, right?
Yeah.
So, and that is the problem with endometriosis because symptoms are sometimes so vague and general. Like bloating can be normal, but bloating can be
also,
endo.
Yeah. Okay. So you're saying also then nutritional changes cannot have significant impact on, endo or PMOS related pain?
I think there is significant change, but I think if you do have endometriosis, perhaps just dietary change alone is not enough to suppress. Remember, we need that progesterone to go anti the estrogen. But a lot of my patients tell me that the diet makes a difference. Well, if we understand endometriosis, we know it's an inflammation kind of condition. So naturally, if you eat food that has a lot of inflammatory type of food, that a lot of my patients tell me pain is more. For example, sugary drinks. I suspect that's where that a whole Chinese saying that of drinking cold drinks cause more pain because a lot of cold drinks are actually sweetened drinks, right? So sugar is inflammatory. Smoking is inflammatory. Alcohol is inflammatory.
Is coffee inflammatory?
Debatable, but I would think a cup or 2 of coffee a day is fine.
Okay. Alcohol is also.
Alcohol is red meat.
Like steak and stuff.
red meat, some very sensitive endometriosis patients, very sensitive to pain and inflammation. They tell me if I take a lot of soy, like I
Yeah.
think it's fine to eat a stick or two every
Yeah.
now and then. It's fine to have a glass of wine every now and then. I'm not saying totally avoid it, but in some patients that's very sensitive. When they drink a lot of soy, they feel it.
Yeah.
Because soy is phytoestrogen.
Right.
That's how diet make a difference.
So nutrition can impact.
Oh, yes, totally. I always tell my patients with endometriosis, go high on anti-inflammatories. For example, omega-3, right? Things like omega-3, turmeric, ginger, all the superfoods that's anti-inflammatory, they do help.
Okay.
They do help.
Good to know. Okay, let's bust some myths and truth. So the myth is drinking too much cold drink can cause PMOS.
Not really. I think a lot of people say it can cause pain. That's what Chinese say. But research has been done on it. It's not true. Like what I say, I suspect it's a lot of colder drinks are actually sweetened. Yeah, so
Okay.
it's the sugar that's inflammatory.
Okay. Oh, we answered this, but I'm just going to ask anyway. Does pregnancy cure endo? No.
No, it doesn't cure endo. It might give a temporary relief because no periods and high on progesterone.
Does a hysterectomy fix the problem?
No, for endo, even for PMOS, no, because essentially it's not about the uterus, it's not about the period, but it's about the hormones. So if the ovaries are still there, the problem persists.
Oh, this is a good one. Can you have both PMOS and endometriosis at the same time?
Oh, yes. A brilliant question. Whoever that asked that must be somebody that's quite updated because in recent weeks and years, there's more and more findings through research that PMOS and endometriosis are correlated. Personally, I do see a lot of those patients. Now, patients with endometriosis, about maybe 10 to 15% of them do have PMOS as well. And there's a lot of patients also that when ultrasound is done for them, they do have endometriosis, but about 35% of them, the ovaries do look what we call as polyfollicular, where there are a lot of follicles there that some doctors label as polycystic ovarian looking ovaries.
Right.
So, brilliant question. There is more and more research going to there. What exactly, people don't really know yet, but there is more and more talks about going to that direction.
Okay. I have one about TCM. I'm not sure what's your stance on that. Someone actually said that she went to a TCM. That guy checked her tongue and said, you have PCOS. Can you tell just from looking at someone's tongue?
I don't know. I'm not TCM trained, but I do know that in TCM practice, a lot of the assessment is by the pulse, right? We say tamak, right? And also looking at the tongue from the
Really?
health of the tongue. They can tell. I can't. I'm not TCM
Yeah,
trained.
okay.
I wish I can do that. I need to do ultrasound to see.
All right, ladies, before we go, Krystal and Dr. Debbie, what is that one or two or three things that you wish your younger self knew?
Okay, so I think I would like to tell my younger self, if I have a chance, to not do my first gynae check only when I hit 30 onwards. Start doing it even as early as when I hit puberty.
Wow.
You know, like maybe, just to see every year a yearly check to see whether everything's normal. Because as a female, I think it's so important that all your health starts from here.
Yeah. This
Yeah.
is like our heart.
Yeah.
Right?
Like
Yeah.
apart from like your diet and everything, as a female, like that went through all of this, like the endo thing and still going through it, here is the most important, I think. It kind of like dictates how your body functions,
Yeah.
like overall. Yeah.
Yeah.
So apart from that, I think never to tell my younger self, I think don't ever think that pain is normal. Yeah.
Don't normalize pain.
Don't normalize pain, and don't even try to condition your body to accept that kind of high pain tolerance level, which I think I pretty much did that to myself over the past 30 over years. Yeah.
Oh dear. Yeah.
Yeah.
What about you, Doc?
I wish women would not dismiss their symptoms. I think women, we are born to be strong, so we tend to like downplay our own symptoms. So if your period is irregular or painful or heavy, or you're having weird bleeding patterns, don't just brush it off as, I think it's just a stress thing, or I think it's just a hormonal thing. Get checked. Because I think in certain conditions like in endometriosis or in cancers, I wish patients came earlier. They did have the symptoms earlier, but it was being dismissed either by themselves or people surrounding them would usually be the ones that's the culprit of that. And get checked early, get diagnosed early, start treatment early. That's always the key. You know, my youngest patient with endo, we do know that the chocolate cyst can turn cancerous. That turned cancer was 34 years old. My youngest PMOS patient that had womb cancer was 30 years old. So I wish they sought for help much earlier. And so then I want women to have good quality of life. So don't dismiss your own symptoms.
Oh my God, I actually have one question I feel like I forgot to ask. Now that you've mentioned younger self and everything, are we born with endo and PMOS? You know, as soon as we got period is 12. Like, if I actually went to a gynae, which I never did, I also did it much later in life, could I have found PMOS or endo symptoms there and then, that young?
All right. If you asked this question 10 years ago, your answer that you're probably going to get is no. But if you're going to ask the question today, the answer is yes.
What?
Right. My youngest girl with cyclical pain, that means every month there's this bad abdominal pain and her menses haven't even come. This is what we call as adolescent endometriosis. Pre-pubertal endometriosis was, I think she's about 11 or 12.
No way.
And my youngest patient with the chocolate cyst, about 6-7 centimeters. She's 17 years old. And so when we go for overseas conference that's just so endometriosis focused, I mean, the entire conferences talk about endometriosis. There's been published case reports on newborn baby girls with the chocolate cyst.
No way.
The whole notion of, I think that is a hereditary genetic sort of correlation is there. Like babies don't have menses. Why on earth they get chocolate cyst? Because they got the estrogen from mom, they carry that genetic. I mean, extremely rare, but there's now more and more talks on adolescents, gynecology, adolescents, endometriosis, pre-pubertal, you haven't hit puberty yet, pre-pubertal endometriosis. And there's still a lot more that's being researched, a lot more that we need to learn. And yes, brilliant question, Maggie.
Yeah, I just realized that now that we talk about younger self, but that is just insane. I have so much to digest. I'm so glad you found Dr. Debbie, and I hope for those of you who are listening, and if you are going through what Krystal went through, and if you're in a time in your life where you're so unsure about what's happening, like what the hell is happening to your body, I hope you find your Dr. Debbie.
So I'm just glad. Thanks, Maggie, for this episode, because I think the key to PMOS and endometriosis is still awareness. A lot of women are still living under the shadow that I was told is normal. If I make a fuss out of it, people will say that, something's not right with me. I'm really proud of Krystal. I always tell my patients, your story speaks a million times more powerful than whatever education that I can give, because that's what people can relate to rather than just, textbook knowledge that I can share.
I think that's why this episode, I really hope will reach out to as many women as possible, because it's literally a life-changing situation that could happen to anyone. And I'm so sorry for those of you who are going through this. I can't even imagine. I can't say I can imagine. I can't even imagine the pain and everything. But I hope this episode, now that you're here, now that you've heard to this point, you've got some of your answers answered. And if you have more questions, please go look for Dr. Debbie if you want to. If you want to reach out to Krystal, I'm sure she'll be happy to.
Happy
we have
to
some new friends.
Share some of my experiences and what I went through, even with my family or people around you, how they view you as maybe you are in your own head.
You crazy. No lah, don't overthink. All the details will be in our description. And thank you. We're head over heels for the both of you. Thank you so much.
Thank you so much for your time.
Thank you. And like I always say, don't forget to fall head over heels for yourself first and always. And if you really need to, please go get yourself checked. Take care. I'll see you in the next episode. Bye.